Well, hello and welcome to Raj Sabha TV. You're watching India Fights Back, the show which gets you all the details and information about India's fight against COVID-19 pandemic. Well, as hopes are high for an early arrival of COVID-19 vaccine, especially after Prime Minister's assurance at the all-party meeting that we are just a few weeks away from having our own COVID-19 vaccine. That was the assurance given by the scientific community as well. The next step before the government and those involved in the fight against pandemic will lie in creating a successful immunization program. A national expert group on vaccine administration has been formed to devise an immunization program. Well, this program is built on end-to-end supply chain and logistic systems. Logistic support or supply chain is critical to any service as it ensures an adequate supply of high-quality vaccine and immunization-related paraphernalia, or to say know-how, infrastructure to all the levels of the program. The management of logistics program therefore assumes immense importance, and especially in a vast country like India. We'll discuss more on this very important issue. We are joined with a panel of guests. Dr. Madan Gopal, Madan Gopal, I beg your pardon. He's a senior consultant health from NITI Aayog. Dr. Arun Sharma, Professor, Department of Community Medicine, UCMS, Delhi. And Dr. Rakesh Aggarwal, Director, GIPMER from Puducherry. Well, thanks all of you for joining us. Let me start with you, Dr. Madan Gopal. How important is the supply chain management, the logistics, once vaccine is ready? I know we are vying to have a vaccine, but the next step certainly is to give the vaccine. So how important do you think is logistics for that, sir?
For any fight, thanks Rajat, for any fight, I think the logistics plays a very important role. If you look at the vaccine logistics, we have to see that what is the cycle of storage and how the vaccines are transported. Right from the manufacturers to the beneficiary. That's the whole chain. And we talk about that. If you look at the way the vaccination program has evolved in the country, or the last major milestone in the vaccination is from 1985, where the Universal Immunization Program started, which focused on improving the immunization coverage, assuring the quality of services, then establishing a system for monitoring, as well as to system of cold chain right up to the facility level and to the outreach level. That kind of system has been built over the last many years.
Right.
Having said this, because that's the immunization program, and if you look at the immunization program, we are the largest, we are the country which is doing the largest number of vaccination across the world. That means we at the most around 6 crore vaccinations in a year, and spread about around 90 lakh immunization sessions. That kind of vast immunization we do. But the challenge with the COVID vaccine is whatever feelers which we are getting, they say that the storage would be from +20, +2 to +8 degree maximum many. But the challenges are there when the vaccine storage comes to -70 degrees or -20. We do have a vaccination setup. To understand that, if you look at the logistics, we have a vaccination setup. Right from a government medical supplies report, which which maintains the buffer stock of the vaccination. Then we have the state and the national level vaccination stores and the district stores, followed by the institutions, the community health center, the primary health centers, which act as vaccine storage. All these institutions, if you talk about the community health centers and the primary health center, we have the vaccine storage in the form of deep refrigerators as well as the ice-line refrigerators. That kind of network is there. When wherever vaccines are required, that vaccine is taken in the cold boxes and the vaccine carriers, and it is taken to the outright. That's the mechanism which exists now. In the one of the guiding principles which has been mentioned by which has been always articulated by the National Expert Group of Vaccine Administration, the overarching principle is the routine immunization is not suffered. So the challenge comes that apart from storing the routine vaccines, how to store the vaccine, the volumes and other things. Yes, still the situation is very fluid because we don't know what would be the volume of the vials which would be coming, what would be the number of vials, number of doses in a vial which would be there, that would be coming. But nevertheless, the government is preparing, and the cold chain which have been augmented. If you look at the private sectors can always be roped in, but the more than 90% of the immunizations happen in the government sector. So private sector has also willing to come forward and provide this cold storage facilities. Nevertheless, the preparations are on. All the state governments, they are working hand in hand with the central government to augment the vaccine carrier. In one of the important things which have evolved over the last many years is having a monitoring system, which has evolved, and now the same monitoring system is being used for the vaccine monitoring and the delivery. Since we are calling it, we used to call it EVIN, and now we are calling it a COVID vaccine system. That's the way the system is evolving. Thanks. Please.
Right. Well, thanks, Dr. Madan Gopal, for your opening remarks, elaborate explanation of logistics, its importance, and the challenges before us. Well, let me open up debate. Let me go off to Dr. Rakesh Aggarwal. Well, many thanks for joining us, Dr. Aggarwal. First up, given the size, width, and margin of a country, would we see one of the most vast vaccination exercise in days to come once we have a vaccine, and what challenges these logistics will place before us?
So there are several challenges. First of all, for covering a large population, or for that matter, covering even some groups in it, we will need a large amount of vaccine. And that amount is going to be much larger than other countries need. The second issue is we will need to transport it from the manufacturing facilities to all over the country, and it has to be transported cold. We have done this earlier, and then we will have to, once we buy it, we'll have to keep it somewhere and transport. Thereafter, in the periphery, as has been alluded to already, we will need storage facilities. We'll need to identify who are the people who are to be prioritized. There are principles that have been laid down by the World Health Organization and by other international agencies, and we in India are following similar kind of principles because those are the ones that are actually logical. So there is a lot of stress on equity, there is a lot of stress on trying to get the maximum benefit from the vaccine as it becomes available, which means we target some specific groups. So these could be groups which are on the front line. So they are healthcare workers and other frontline workers who are leading the fight against COVID. That's because they come in contact with the public the most often. So if they get infected, they infect a lot of people. So if a doctor is in the hospital or a nurse, they would infect a lot of people. And those are the people who are at a high risk. So they are going to be immunized. Then we know that elderly and those with comorbidities are at a higher risk of severe disease, needing ventilators, needing ICU care, which is very difficult to provide, and death. So they are going to be another priority group that will be immunized to begin with. And then gradually we will move on to groups which are at a lower risk. We will have to keep a track of these people. This vaccine is different from other vaccines. In other vaccines, say DPT, you could get one dose from one manufacturer and a second dose from a second manufacturer and a third from a third manufacturer. These vaccines, we as a country will need so much that we might have to buy from multiple manufacturers, but these are not interchangeable. So if we have one dose from one manufacturer, the person will have to get the second dose also from the same manufacturer. So we need to make sure that once you give a person one dose, the second dose is available at that location as and when it is needed in a timely manner. So we'll have to arrange for so much syringes. So if we want to immunize 30 crore people, we need 60 crore syringes, knowing that we need 2 doses per vaccine. So each of these is a challenge. We'll need a lot of healthcare workers to give this vaccine. We will need to have a system should anybody develop any adverse event that can be picked up. So one doesn't expect that much would happen. Still, we have to be prepared for that. So these are some of the challenges. Let me stop here. We can discuss further as we go.
Absolutely, sir. Let me go off to Dr. Arun Sharma. Thanks, Dr. Sharma. You've been waiting for long here. Sir, our research team at RSTV has compiled some fabulous data here. Like India has been running a successful universal immunization program for past 50 years, vaccinating about 25 million children and adults each year. Of course, These are simultaneous years and all. When it comes to COVID, given world is watching, well, we are vying for the vaccine. So are we going to see an immensely vast exercise? Will that be different from every other exercise of universal immunization that we have seen in the past with other pandemics?
Thank you, Rajat, for having me on the show and putting this important question. Now, as you rightly mentioned, that we have already built up a very good infrastructure over the years to roll out the universal immunization program. See, what started in 1985 with 5 vaccines, we have now gone on to include so many other vaccines. And to add to that one particular component, if you recall, that in order to eliminate polio virus from India, the country took one of the biggest exercise in the world of vaccinating all under 5 children on the same day, what we call as National Immunization Day or Subnational Immunization Days. And we have seen that when such a massive task was required to be carried out over the whole country, we were prepared. We could mobilize the resources in terms of logistics, in terms of infrastructure, and in terms of manpower that was required to give vaccine to all under 5 children in one particular day all over the country. And you may remember that even at railway stations, at bus stands, and even at all possible points where the children are in movement, who are not at their home, even they were vaccinated on that day. So historically, I will say that we have always risen to the occasion, and we have been able to give the vaccines as and when required. And thanks to that we have been successfully able to eliminate polio. So this exercise in the past gives me a lot of confidence to say that though the challenge is bigger, we have to give COVID-19 vaccine almost to the entire country, or rather the whole world needs the vaccine. Every citizen needs the vaccine. So the challenge is manifold. But at the same time, we know that this exercise will be done in phases. As Dr. Aggarwal had been pointing out, that we have to prioritize who are the people who are going to get the vaccine first. So if it is the frontline healthcare workers, if it is our police force and the people who are working to take care of the COVID-19 patients and the COVID-19 system, then it is easier to roll out because they are working in hospitals, they are working in institutions and organizations. So those institutions and organizations will be able to take the vaccine and give it to the people who are working there. So the first phase will be very easy. But when it comes to the second phase, like giving the vaccine to the general population, where we have an infrastructure in terms of primary health center, we have community health centers, we have ANMs, we have multi-purpose health workers who are giving vaccine. But that is being restricted to pregnant women and under 5 children. Majority of the vaccines are given to them. Here we have to give vaccine to every citizen, for example, or even for that matter, the vulnerable population like senior citizens and people having comorbidity, identifying them, listing them, and bringing them to the health center. The other challenge is, are we going to go door to door to give the vaccine, or we expect them to come to the health center? Now, if they come to the health center, do we have adequate space and adequate infrastructure available that if thousands of people in a particular village or in a town need to be vaccinated over a period of time, how are we going to manage that? So these kind of micro level planning, micro level working out and detailing is required. So I'm hopeful that we can do that, but it requires extensive planning and extensive chalking out the entire program, the phases, the days, the number of doses required. Besides the biggest challenge of maintaining the cold chain in terms of like minus 70 degrees centigrade, if we are going to use the Pfizer vaccine, minus 20 is possible because the polio vaccine, BCG vaccine, and measles vaccine, which we are giving, or MMR vaccine, which we are giving, they're already being stored at minus 20 degrees Celsius. So we have that infrastructure. But yes, to maintain at minus 70 degree will be a challenge. We really need to create infrastructure for that. So there are several issues which need to be addressed before the COVID-19 vaccine can actually be rolled out.
Well, Dr. Arun Sharma, just stay on, sir. You have raised fairly pertinent issues, and of course, like these are important things. I know that we have already the government has already formed national expert groups on vaccine administration. We also have the COVID-19 task force under ICMR. Let me come to you, Dr. Madan Gopal, sir, from NITI Aayog. How are we going about these challenges? I'm sure like we have also, I mean, by we, I mean the government, the apparatus working in a fight against COVID-19. How is that going ahead in terms of addressing these challenges, especially related to vaccine delivery, selection of suitable vaccines, procurement, prioritization of groups, as two other panelists also mentioned, especially the prioritization of group. How are we going ahead with that, sir?
This is a very interesting question, as Dr. Aggarwal has already pointed out, that we have to prioritize people based on the morbidity. The morbidity data which we are having in the country, and we happen to analyze that, and which have been now projected also, saying that 50%, if you look at the mortality data, 50% of the deaths, 80% of the deaths have happened in 50 plus years of age. That's the age which we are currently mulling over whether to include or not. Whereas the WHO and other countries, we are also looking at what the priority, how the priority groups are being evolved in other countries. That is mulled over it. And based on this, the National Expert Group on Vaccine Administration will take a call on that, which are the groups which can be included. But for sure that the healthcare workers and the frontline workers, there is a unanimous unanimity in across the globe that these are the two priority groups who would be receiving this vaccination. Second thing is, as Dr. Sharma has pointed out, during the earlier round, that was the pulse polio immunization which we have talked. Apart from that, if you look at the Indradhanush, mission Indradhanush, which has massive exercise of right up to the adolescents, we have been able to inoculate or do vaccination. And the state has been consistently doing that and successfully. We have having 2-3 rounds of that, and we have been quite successful in that. And apart from that, the private sector can be roped in for mobilizing the people, for helping in the vaccine logistics, which they did during the pulse polio immunization time. And because it won't be a one-time exercise, it has to be done in a phases. First phase would be the priority groups and the healthcare workers and the other thing. Then in the next phase, when the availability of the vaccine, we don't know how much vaccine would be made available to us and which vaccine would be available. That's the question which we are answering. But nevertheless, based on the stockpiles and other things, we would be able to take care of the priority groups, that is the healthcare workers and this. And once it comes to the general population, as we did with the pulse polio immunization, we will be roping in the community-based organization, the NGOs and the other partners to help the people in mobilizing the efforts of the government. And the vaccination anyway would happen at the government centers or the identified centers. The support which the other people can provide in the form of mobilization, in the form of center support, institutional support, and the vaccinator support. In this way, things are evolving. And as Dr. Sharma has pointed out, that we have always risen to the occasion. And this time also we will rise to the occasion. Over to you.
Right, sir. Right. Well, that is Dr. Madan Gopal elucidating on how government is going ahead and preparing its infrastructure. Let me get in Dr. Aggarwal here. Sir, given as we're discussing about the challenges and of course like the logistics, will it also be a massive center state exercise in terms of the coordination and of course like as Dr. Madan Gopal pointed out, identifying the right groups so as to get them vaccinated first? So
a lot of activity is happening behind the scenes. The basic policies are clear that it's going to be the frontline workers, including healthcare workers, who are likely to be the first priority group. For those, the states and center are working together. There is an excellent cooperation, and the list of people who are working in healthcare facilities prepared in place in the center and as states in each institution so that the database is ready. Also, there is a need to identify people who would act as vaccinators. For that, again, that's going to be easier in this initial phase when we are taking mainly healthcare workers and frontline workers. Those are being identified. Many of them are going to be in the database of vaccine recipients also, so they are being listed. The cold chain facilities, how much space is available, all that has been listed. that is being, additions are being made wherever that is necessary. There is a lot of emphasis that there should be uniformity around the country so that all states and union territories get a similar share according to their population. Transport is being looked at. So there is a whole lot happening. Prioritization, we are clear that it's going to be age-based after we cover the frontline workers. Now it is possible that we first use, because vaccine is going to become available in installments, so we might initially vaccinate people above a certain age group, and then we bring down the cutoff in the next round and in the next round, because we want to make the best out of whatever is vaccine becomes available at what time. And because the risk increases progressively with increasing age, that might have to be done. But again, these are fluid situation. We yet do not know how much vaccine will become available at what time. One will also have to look at what is more efficient to do, how we do this. So things will evolve. But I can tell you that a lot of activity is going on. The National Expert Group on COVID vaccination, it has had more than 10 meetings. Every meeting is very animated. There are a lot of other groups working on it. There's a lot of has happened in terms of the software which will be used so that people's names can be fed. They can get messages beforehand whether the vaccine is available, where they are supposed to go. A lot is being done so that this process goes smooth once it starts. And I'm sure, as some other people have said, we always, as a country, rise to the occasion, and rise we would to the occasion this time too.
Well, it's extremely well summarized, Dr. Aggarwal. Just as we close the show, let me go off to Dr. Arun Sharma. Well, sir, as you in a previous reply, you pointed out about the categories, about the challenges. Well, once again, elucidating on those points, what do you, as per you, requires to have a right supply chain management, the right quantity and the right conditions and right place, sir?
So there is a system of actually calculating the number of doses required according to the number of people who are to be vaccinated. And as far as we know right now, for example, that both the vaccines which are in the front and were most likely to come out in the market first, 2 shots are required for every person at an interval of 4 weeks. So keeping that in mind, the system as it already works, that first you have to calculate the estimated number of doses required at the micro level. By micro level, I mean, suppose a primary health center is a vaccination center. Now, and this vaccination center may be catering to a population of 30,000 in that area. That are the norms which are already set up. But the population might have swollen and we may be looking at a 50,000 population. So in that 50,000 population, if the priority group or the total number of people to be vaccinated are 20,000, then we have to look that these 20,000 people can be vaccinated on a given day. How many vaccines can be administered? I read in one of the reports that the good and well-trained vaccinator are capable of giving 15 to 20 shots in 1 hour. So if we can manage our queues, and then probably in a smooth manner, if we can vaccinate 15 to 20 people in 1 hour, then 5 hours will give us, say, 100 vaccinations possible. That means in a day, 150 or 200 vaccination, one vaccinator can do. So this way, we have to make calculations that to cover the entire target population of that particular area, how many vaccinators are required and over how many days we will be able to meet the target. Now, this is flexible. At a PHC, because the target population is 30 to 50,000, it will be differently set. If you are doing it at a community health center, it will be a different number because the population covered is 1 lakh. Whereas when you shift to the larger metropolitan cities or cosmopolitan cities, no doubt the number of centers will be more. But at the same time, the density of population, that means the number of people who are to be vaccinated from one particular center is manifold higher. So these are other things we have to look at. And another important issue, which I think from the social and the community perspective is that we as the provider are deciding that this is the priority group who should get the vaccine. but there may be demand from the community that how this prioritization is rational. For example, if somebody says that every life matters, so if every life matters, how can you prioritize? Why not the general people should also get it? This kind of questions we can also face. And before I conclude, I want to make one apprehension, Rajat, which I want to share with the audience, that vaccines should not be treated as the panacea for COVID-19. It's not that the vaccine, the moment it is introduced or it is given, the COVID-19 will go away. We have to remember that besides the existing tools of wearing mask appropriately, maintaining the social distance, and keeping the hand hygiene intact, the vaccine is just one more tool. So instead of 3, now we are going to have 4 tools. There should not be any kind of complacency that once I am vaccinated, I can do away with my other precautionary measures which I am taking. Because the 90% or 95% efficacy which the companies are talking about is like when you go to buy a car, the company says that the mileage given is 27 kilometers per liter, but that is in ideal condition. When you actually run the car on a road, it may be 18. So what is 90% or 95% efficacy? For the manufacturer, in terms of efficiency of the vaccine, once it is rolled out in the community, may be lesser. It may be 60 or 65%. We have to keep that in mind. Therefore, the intensive campaign for continuing to follow the preventive measures of mask, sanitization, and social distancing should not be ignored. Right. This is the last thing I wanted to say about
absolutely,
it.
Absolutely, Dr. Sharma, and all of us absolutely agree with that vaccine is an absolute necessity and one of the tools to fight the COVID-19 pandemic, whereas the existing mechanism that all of us are braving this pandemic with, be it mask, be it social distancing, and maintaining sanitization is required as well. Well, thanks, gentlemen, for joining us and throwing light upon this extremely important issue of logistics and cold chain management, of course, and the challenges associated with that and how we are preparing ourselves. Many thanks for watching Raj Sabha TV's special presentation on India's fight against COVID-19. But before we leave, I'll once again reiterate to all our viewers, please follow small things so as to fight this COVID-19 pandemic. It's an RSTV appeal. Keep wearing mask. Keep washing hands 20 seconds at least. That's what the experts have told. More the better. And follow physical distancing. These are small little things, important nonetheless, to fight this pandemic. Stay safe. Keep watching Raj Sabha TV. And thank you for watching this edition.
Defeat